Learn how to use it. First, wash or clean your hands and make sure they are dry before starting the test. Make sure your test is within the expiry date shown on the side of the box. If so, you can proceed. In your pack, you have a test device, sterilized swabs, extraction tube with buffer, nozzle, package insert, and the box size of 1 or 5 tests. The box acts as a tube stand. In the box of 25 tests, you'll get this plastic tube stand. You'll also need your choice of a timing device and a bin to safely dispose of the waste. Now let's get tested. Peel the foil from the top of the extraction tube. Then place the extraction tube into your test tube holder or box if you are using the 1 or 5 pack. Taking a sample is easy. Tilt your head back slightly. Insert the entire soft swab into one nostril and rotate the swab at least 5 times against the nostril wall. Use the same swab and repeat it in the other nostril. If the swab stick breaks when you are doing this, use an unused swab. Pick up the extraction tube and dip the soft swab into the liquid in the extraction tube. Rotate for at least 15 seconds while pressing the swab head against the inside of the tube to dissolve the specimen in the liquid. Remove the swab from the tube and wipe the swab head on the edge of the tube. Discard the swab in the trash bag. Tag the nozzle, screw the nozzle on the top of the extraction tube and tighten it. We want the nozzle to be tightened enough to shake the tube safely. Shake the extraction tube vigorously. Now we are ready to test. Add 3 drops of sample into the sample well and start a 10 minutes timer. After 10 minutes, the test can be read. The test result is displayed with a red line or no line at the control and test point marks. First, let's check if the test is working correctly. If there's no red line at the control line mark, you have an invalid test. Please report the invalid test to your retailer, provider, or to us. You will need to repeat the test. A red line at the control point only tells that your test is working correctly and that you have a negative result. You are unlikely to have COVID-19. If the red line at the control point and test point appears, you have a positive result and it is very likely that you have COVID-19. But this should be confirmed. Please call your health department and perform a confirmatory PCR test if the test result is positive. Ensure you isolate yourself and please wear a mask at all times in public while traveling to take your PCR test. Once 20 minutes has passed, the test will be invalid, so make sure to read it promptly. Safely dispose of all test materials in your bin. And that is how you use the really rapid antigen COVID-19 test.